Imagine an itch. So intense, it leaves you tossing and turning at night, slowly dragging your mood down. But we both know it's not just an itch, don't we? Eczema, or atopic dermatitis, is far more than a mere inconvenience. It's a chronic condition that affects as many as 1 in 5 children and 1 in 10 adults, encroaching on daily life and overall well-being. Now, consider this. 86% of children and 84% of adults with eczema report restless nights and poor sleep. And it's not just the physical discomfort we're talking about, it's the emotional strain as well. Almost 43% of adults have faced depression over the past couple of years, all because of this relentless condition. Eczema doesn't have to dictate your life. In this video, I'll be walking you through what eczema truly is, its underlying causes, the various forms it can take, and, most importantly, how to manage it effectively. So, let's embark on this journey together. I'll walk you through everything you need to know in under 10 minutes. So, sit back, relax, and let's get started. Did you know that eczema is, in fact, an umbrella term encompassing a variety of skin conditions? When people hear eczema, they often think of atopic dermatitis, that rather bothersome form that results in itchy, inflamed skin, and is frequently linked to other allergic tendencies, like asthma and hay fever. It typically begins in early childhood and can signal a lifelong interplay with these related conditions. But it's more than just a rash. It's a subtle hint that your immune system may be operating in a heightened state of alert. Now, atopic dermatitis is merely one piece of a rather intricate puzzle. There are other types of eczema, each with its own distinct traits. We have allergic contact dermatitis, which flares up in response to allergens, irritant dermatitis, triggered by exposure to harsh substances, and stasis dermatitis, often a result of poor circulation. Then there's dyshydrotic dermatitis, which causes small, itchy blisters on the hands and feet, and discoid dermatitis, which appears as coin-shaped patches on the skin. Finally, seborrheic dermatitis tends to affect the oilier areas, such as the scalp. Each type requires a unique approach to treatment, so understanding the nuances of each is absolutely key to managing them effectively. Before we delve into the root causes of eczema, allow me to introduce myself. I'm Dr. Dana Beiki, a pharmacist prescriber with a particular passion for dermatology. Now, I'm not here to peddle courses or promote products. My sole aim is to help people gain a deeper understanding of their skin conditions and provide practical advice for managing them effectively. I'd love to cultivate a community where everyone has access to high-quality healthcare information, regardless of their circumstances. If you find this content useful, do consider liking the video and subscribing. It really does help me reach more people and continue making a difference. Eczema is far more than just a rash or dry skin. It's a deeper, intricate process unfolding beneath the surface. It's driven by 3 key elements: a weakened skin barrier, an imbalance in the skin's natural bacteria, and an overactive immune response. When the skin barrier is compromised, allergens and irritants can slip through, sparking inflammation. At the same time, microbial imbalances only serve to exacerbate the situation. So, the condition is propelled by 2 distinct forces: the outside-in theory, where external irritants penetrate the skin, and the inside-out theory, where an overactive immune system disrupts the skin from within, creating a relentless cycle of itching and inflammation. Understanding these underlying causes is the first step to regaining control. But to truly break this cycle, an accurate diagnosis is crucial to guide the most effective treatment approach. Diagnosing atopic dermatitis is far more nuanced than simply identifying a rash. It requires a comprehensive assessment guided by the Hanifin and Rajka criteria. Clinicians look for at least 3 major signs, such as persistent itching, dermatitis in characteristic areas like the elbows or knees, or a family history of allergies. In addition, they need to identify at least 3 minor signs, which might include subtle facial features, known triggers like food or environmental irritants, or complications such as recurrent skin infections. It's a meticulous process, but one that ensures a more precise diagnosis, essential for tailoring an effective treatment plan and managing atopic dermatitis with confidence. Managing eczema flares can be quite the challenge. While topical corticosteroids are often the go-to option, it's absolutely vital to use them correctly, by selecting the right strength, duration, and application technique depending on the severity and location of the eczema. For delicate areas like the face or genitals, a low-potency steroid is ideal. On thicker skin, say, the trunk or limbs, moderate to high potency options are more appropriate. Particularly stubborn spots, such as the palms or soles, may warrant very potent steroids, but only for short periods and always under close supervision. How you apply the steroid is equally important. Use the fingertip unit method to measure out the correct amount and spread it evenly over the affected area. And remember, not to stop abruptly once the skin clears. Instead, gradually reduce the frequency to prevent rebound flares. For instance, if I were treating a 2-year-old with eczema on the head, neck and limbs, I'd recommend 1% hydrocortisone ointment on the face and neck, applied twice daily for a week, tapering off over the next 3 weeks. For the trunk and limbs, Umivate twice daily for 2 weeks, then reducing to once daily, and eventually every other day over a further 2 weeks would be appropriate. If steroids alone don't quite suffice, consider introducing steroid-sparing agents like tacrolimus for maintenance therapy. The right formulation also makes a difference. Ointments for dry skin, creams for moist areas, or alcohol-free solutions for the scalp. There's a common misconception about steroids, which often leads to fear and ultimately misuse. Many worry about side effects, resulting in underuse or outright avoidance, which can actually worsen the condition. The key is knowing how to use steroids properly. They can be powerful allies in achieving healthier, happier skin. Now that we've addressed these concerns, let's move on to another vital aspect of eczema care, your emollient routine. Keeping your skin beautifully hydrated is more than just a daily ritual. It's an essential step in preventing those troublesome eczema flare-ups. But I'm afraid not all moisturizers are up to the task. Ordinary lotions often fall short, and neglecting proper skincare can lead to uncomfortable, even painful flares. This is where emollients become your most trusted ally. Rich, soothing ointments are perfect for very dry skin, while lighter creams are ideal for daytime use. Be sure to apply them 2 to 3 times a day, and always use clean hands to avoid contamination. It's not just about choosing the right type. How you apply them is just as important. Pair your routine with quick, lukewarm baths and non-perfume shampoos to reduce irritation and build a resilient moisture barrier. Mastering your emollient routine is absolutely key to keeping your skin at its best, but it's only part of the puzzle. Now, let's explore how to avoid those common triggers that can set your skin off. Imagine having to scrutinize everyday items like laundry detergent or your favorite scented lotion. For those living with eczema, these seemingly benign products can be the cause of distressing flare-ups. That's why it's so important to steer clear of potential irritants. Opting for fragrance-free skincare, using non-biological washing powders, and choosing natural fabrics like cotton can make a significant difference. But it's not just about household items. Environmental factors such as pollen, or even something as common as a viral infection, can exacerbate symptoms. By identifying and eliminating these triggers, you can regain control and reduce flare-ups, paving the way for much smoother days ahead. However, it's important to remember that eczema-prone skin isn't just sensitive to triggers. It's also more vulnerable to bacteria, fungi, and viruses, which can turn minor irritations into more serious complications. Recognizing the early signs is absolutely essential. Red scaly patches might indicate a fungal infection, while yellow crusting could suggest a bacterial one. And viral infections, like cold sores, can even lead to eczema herpeticum, which requires urgent attention. By spotting these symptoms early and seeking prompt treatment, you can prevent complications and keep your eczema in check. Managing eczema isn't merely about soothing itchy skin. It's about implementing the right strategies to truly regain control. With the proper treatments, such as steroids for inflammation, emollients for hydration, and avoiding common triggers, you can break the cycle and find genuine relief. If you found this content helpful, do give the video a like, and please feel free to share your own eczema tips in the comments, or let me know if there are any topics you'd like me to cover next. Your support genuinely helps me create more content that makes a difference. Thank you so much for watching, and I look forward to seeing you in the next video.